Welcome, everyone. My name is Britton Slagle. I am the founder and executive director of KarmaSue. Our mission is to support Coloradan families enduring companion animal cancer through education, counseling, and financial assistance. We'd like to thank you for attending this special online education workshop today. If you are interested in watching any of our previous workshops, please visit our YouTube channel. And if you have any questions or would like to connect with us directly, you can send us an email at admin@karmasue.org. Our special guest facilitator for this unique workshop is Dr. Jessica Pierce. Dr. Pierce is the author of The Last Walk, Reflections on Our Pets at the Ends of Their Lives, which explores end-of-life care, dying, and euthanasia in the lives of our companion animals, weaving analysis together with the journal chronicling the decline and death of her beloved dog, Odysseus. Today, Dr. Pierce will help us analyze our pets' quality of life and understand palliative care. Although this can be a difficult topic to discuss, it is vital and will inevitably help us honor the human-animal connection until the very end. Thank you for joining us in this safe space to learn more about the end-of-life companioning and how to navigate end-of-life care and decision-making. Please feel free to use the chat box to ask any questions you may have throughout the presentation. We have saved time at the end for Dr. Pierce to answer them. On the final slide, you will see ways in which you can learn more about Dr. Pierce and connect with KarmaSue directly. Now I'll hand things over to Dr. Pierce.
Okay, thank you. And thank you for having me. Animal death and dying is definitely not a typical area of interest for somebody in my field of bioethics. And for the first 15 years of my career, it really wasn't on my radar, even though I've been an animal lover and companion to animals for my whole life. It became of really significant personal and professional interest to me about 10 years ago, and I blame it all on my dog, Odie, who is here, a beautiful dog. That's Odie when he was about 4, enjoying himself out in the Moab desert, camping. Here's Odie when he was about 12. When Odie turned about 13, he started to visibly deteriorate. So this dog of once boundless energy had trouble walking around the block. His back end was really weak and really unsteady, and he started to fall all the time. He had paralysis of his laryngeal paralysis, so he had trouble breathing. He kind of sounded like Darth Vader all the time. Often when he drank or ate, he would choke. His eyesight was getting pretty dim. He didn't hear very much, and all in all, he wasn't doing very well. He was losing interest in his 2 great passions in life, which were people and food. And so his mortality was kind of hovering over me all the time. This is Odie at about 14. So you can see he's really, really wasting away and not looking so good. At one level, I was coming at Odie's mortality and end-of-life struggles as a total beginner, because he was the first dog where I had responsibility for his care and for his decision-making. On the other hand, I was also coming at his end-of-life as an expert, because these end-of-life issues in human medicine are really the bread and butter of my field. That's what really got the whole field of bioethics initiated in the 1960s, were ethical questions about, how do you judge the quality of somebody's life when they can't speak for themselves? Is it ever okay to hasten the death of a patient who is suffering and for whose suffering we have nothing to offer? And it struck me that the issues I was facing with Odie were really very much the same as the ones that I was writing about and thinking about and teaching to medical students in my professional life. So I decided to write a book, and that was this book that Britt mentioned, The Last Walk, which is part memoir about my last year of Odie's life with him, and my struggles of decision making through this process. I like to think of the last walk and also my subsequent work in this area as both a tribute to Odie and also an apology, because had I been armed with what I learned in writing the book and what I've learned since then, I think I could have done a much better job of helping ease him gently through his last passage. So by end-of-life care, end-of-life companioning, what I mean is how we care for animals in the final stages of their lives, whether they're elderly or terminally ill, whether they're imminently dying or simply drawing near the end of their life. End-of-life care can include palliative care, pain management, quality of life assessments, hospice care, hospice assisted or hospice supported natural death, euthanasia, and aftercare, including the disposition of the body and the memorialization of a life well lived. There's way too much to cover in an hour, so I'm going to focus mainly on the question of animal suffering and how to assess quality of life, but I'll touch on all of these things a little bit throughout this hour. And I hope that in particular that my remarks can help clarify the process of decision making. So before I really get into a nuts and bolts conversation about quality of life assessment and suffering, I'd like to frame the discussion of companioning our ill and dying animals within the work of human hospice pioneer Dame Cicely Saunders, who was really the founder of the hospice movement. She articulated 4 commitments or components of care for the dying, which I think really encapsulate what I hope we can accomplish with our animal companions. First of all, we need an expansive and holistic view of the nature and relief of suffering. Dame Cicely used the phrase total pain to reflect that suffering is not just physical, but also psychological and relational. When it's not possible to eliminate the physical causes of pain, the goal then becomes to keep suffering well enough at bay that it doesn't dominate the patient's experiential world. Second, care should seek to protect the integrity of the patient and allow the patient to live in ways that honor what they find most valuable and meaningful in their lives. Third, dying takes place within a system of interrelationships and a network of shared meanings. Dying involves an entire family. Care then should support relational structures and not disrupt them. And then fourth, that the experiential process of dying involves all aspects of personhood, and I'm using personhood here to include the personhood of animals. So emotional, physical, spiritual, and social, and it can be deeply meaningful not only for the individual who is dying, but for the individual's extended family. The challenging part is how to bring these commitments to fruition and how to support animals and caregivers so that these values can be maintained. So talking a little bit about pain, or Saunders' notion of total pain. Pain is the most common reason humans see a physician. And within human medicine, pain is considered the 5th vital sign. And access to adequate pain medicine is seen as so ethically important as to be considered a basic human right. Pain control should also be front and center in our considerations as we care for ill and dying animal patients. We can't erase the reality of pain, but we can care about it and we can commit to doing our best to address it. The manifestations of physical pain can be observed, measured, understood, and addressed objectively. There is, however, great individual variation in how animals experience, cope with, and communicate about pain to those around them, making pain management a real challenge. A further challenge is that physical pain is only one small subset of a much broader range of suffering that can plague animals at the end of life. Animals, like humans, can experience loneliness, boredom, frustration, anxiety, fear, isolation, and helplessness. One of the most difficult aspects of our experience with Odie was that he appeared not to be in physical pain, or at least that's what vets told us. I was assured by several different veterinarians that his pain was, or his problems were neurological. So signals weren't getting from his brain to, for example, his hind end. So he wasn't aware that he was curling over on his toes. He wasn't aware that he was having a bowel movement in the middle of nowhere for no apparent reason. And yet it was clear to me and to those who loved Odie that he was suffering. You could see it in his eyes. I think you can see it in this picture. It's one of the reasons this picture is hard for me to look at and also important to me. And you could also see it in the fact that this once very gregarious, tactile, and hungry dog had receded to his oatmeal-colored bed under the piano and really disengaged from the life of the family. People who knew Odie well would say to me, well, he's just not there anymore. And I found myself saying either to myself or to Odie or to my family, poor Odie, hundreds of times a day. Suffering is, of course, even more subjective and difficult to define and pin down than physical pain. And perhaps for this reason, it's even more feared by caregivers. There's no universally accepted definition of suffering in members of our own species, the human animal, despite extensive literature and millennia of writing and discussion about suffering. So no wonder it's hard to pin down what suffering might look like or feel like to animals of other species. Nevertheless, the suffering of animals in our care is something, in my opinion, we have an obligation to try to address as best we can. Suffering can be caused by physical symptoms of illness or aging, including hypoxia or lack of oxygen or difficulty breathing, nausea, itchiness, and disorientation, among other things. It can also be caused by what psychologists will call negative affective states. In other words, negative feelings or feeling states, such as fear, frustration, loneliness, boredom, and loss of agency or loss of sense of control over your choices and your environment. Affective states such as anxiety, depression, and mental exhaustion can originate in organic processes, for example, from central nervous system disorders, and they can originate in psychological ones. For example, an emotional response to a situation or experience, for example, chronic pain, or some combination of both. So how do we know when an animal is suffering? Some indications can be gleaned just from observations of behavior and interpretation of what feeling state is being reflected in the observed behavior. These interpretations can be based on knowledge of behaviors that are normal for the species and also for the individual. And those will certainly overlap, but they're not always the same. And deviations from normal behavior patterns can be important indications of suffering. And one deviation that's commonly seen clinically is a reduction in motivated behaviors such as wanting to eat or seeking social interaction, both of which we experienced with Odie. Tracking mood is another useful tool for assessing pain or other kinds of suffering in animals. Now, animals like humans don't just have fleeting emotions, they also have longer term mood states or affective states. Animals can be happy or contented. They can be pessimistic or optimistic. They can suffer from depression and anxiety. So recognizing suffering requires not just attention to immediate stressors or feeling states, but also to underlying mood states. If an animal who's been for most of her life curious and outgoing, if she becomes suddenly fearful and withdrawn, that's a pretty good indication that something is going on and that animal might be suffering. A loss of control over one's environment, what you might call in the human literature, and I think I use this language also in the animal literature, a loss of agency is also strongly correlated in human patients with suffering, and I think also in animal patients. Serious illness and disability can create conditions under which an animal is continually exposed to painful or aversive stimuli. For example, an animal who suffers from severe pain in his hips every time he tries to stand up may eventually just give up trying, a kind of a state of learned helplessness, of just giving up. And as in humans, a state of learned helplessness is associated with depression, anxiety, and frustration. So in addressing suffering, caregivers have to try to distinguish between those behaviors that have changed because of physical discomfort, like pain. So for example, a dog who no longer wants to chase after a ball because of degenerative joint disease that is painful, from behaviors that have changed because of a change in mood. So a dog who doesn't want to chase a ball because of a sense of listlessness or depression. And it's easy to say we need to distinguish these. It's actually in practice can be very tricky to try to untangle these threads. So there's a really good TED Talk by a human palliative care physician named B.J. Miller. It's called What Really Matters at the End of Life, and I highly recommend it. And as I listened to it, I kept having the feeling that everything he said about human end of life applies equally well in our care of animals. And I'm going to share just a couple of his insights because they speak to the issue of suffering and of total pain. So he suggests what he calls a couple of design cues or shifts in perspective to guide a more compassionate approach to end-of-life care. First, he says we need to tease out unnecessary suffering out of the system. And to do this, we have to recognize that there's a distinction between necessary suffering, or suffering which is just part of the human or animal condition, and unnecessary suffering, which is suffering that can be addressed. Suffering is not an inherent evil. Indeed, bad feelings, or what evolutionary biologists would call negative affective experiences, are essential to our survival as mammals. And some measure of suffering is inevitable in old age and illness, and before that too. The etymology of the word compassion, Miller notes, is suffering together. Our job with our animals then is not to try to blot out all suffering, but to address what we can and to bear witness to and be compassionate in response to the suffering we cannot fix. Miller also says that we can set our sights on promoting well-being so that the life of a dying person or a dying animal can be more wonderful and not just less horrible. And one key way to do this, he says, is through the senses, through smell, taste, feel, and so forth. For our animal companions, it's easy particularly if we're tending to demanding and perhaps complex physical aspects of care, to lose sight of how we can tend also to the senses. And this picture, which you may have seen floating around on the internet, is of a man whose dog can't walk very well anymore. So every day he takes his dog swimming in Lake Michigan in the summer, obviously not in the middle of winter. And this is his way of attending to the senses, to his dog's need for stimulation and enrichment in a way that is accessible to a dog with compromised mobility. We know from research in ethology and neurophysiology that animals don't just experience negative emotions, and everybody who lives with a pet knows this too. They also experience pleasure, happiness, love, joy. So our ministrations to ill and dying animals can be aimed not only at alleviating suffering, but also providing pleasurable experiences. For some animals, delicious food brings them joy. For others, it's play, however modified. Well, for others, it's social closeness, just, sitting next to us on the couch, on a blanket, touching fur to skin. In addition to providing sources of joy, we can also think about interventions that are designed to proactively enhance an animal's sense of being in control. For example, using positive reinforcement techniques to train an animal to approach a veterinarian and consent to treatments like blood draws. Similar positive reinforcement techniques can also reduce the burden of treatment at home by reducing the stress associated with the administration of medications and other treatment. And Marty Becker's work on fear-free veterinary care is, I think, of singular importance within the context of hospice and palliative care for animals, because of this attention to fearful encounters and how hard those are for animals, and how it isn't easy to overcome, but it's possible with hard work. So working to create interactions with veterinarians and other caregivers that are free of fear will likely result in greater success in improving quality of life with minimal cost in creating negative feelings in animal patients. So I'm going to move on now to share some thoughts on how to track what is called in human medicine quality of life. The concept of quality of life was developed in human medicine during the 1970s as a way to measure how much an illness or disability affects an individual's well-being and activities of daily living. And it's now a pretty common part of our medical vocabulary, and also increasingly more common as a part of the veterinary vocabulary. And as a caveat here, how best to define and measure quality of life for humans, much less for animals, is really contentious. So I'm just kind of pushing the contention aside, but just to acknowledge that there's a lot of disagreement about what it is, how to measure it, and so forth. So assessing quality of life involves, at the most basic level, an intuitive sense of how another creature is feeling. So looking in Odie's eyes and saying, he's really having a hard time. Intuition, though, is difficult to articulate and explain, and it isn't always completely trustworthy. So using an orderly process for working through decisions can clarify, I think, and guide intuition and give us increased judgments about, or increased confidence about our judgments and decisions. And this is where quality of life scales and trackers can really come in handy. There are a number of quality of life scales out there on the web, and I'm going to talk about a couple just to give you some examples. And also to give some ideas about how you can best use these resources. They're sort of blunt tools that are being applied to very fine work, so they need some refinement in their actual use with you and an animal. Sorry, this is a little bit blurry, but I'm gonna tell you the important things on here anyway, so don't worry about it. The most popular quality of life tool or scale is this one right here. It's often referred to as the POSPIS scale, and it was developed by veterinary oncologist Alice Villalobos. And basically what it does is it's a scoring, a numerical rating of how your animal is doing on a scale of 0 to 10, with 10 being good and 0 being very bad, in 7 categories. So hurt, hunger, hydration, hygiene, happiness, mobility, and then this sort of nebulous category called more good days than bad. The good things about the POSPIS scale are that it's simple and it's straightforward and it's relatively objective, but it's not my favorite tool out there. And here are some of the reasons why. For one thing, it places an equal numerical rating on things that aren't really equally important in terms of an animal's quality of life. For example, hygiene is rated the same or scored the same as pain and labored breathing. But labored breathing and pain, particularly acute pain, are far more distressing to an animal than a poop or pee accident in the house. So that's one thing that I don't like about this scale, that it doesn't, especially for pet owners who don't really know how to assess suffering, it suggests that having to wear a diaper is as distressing to a dog as not being able to breathe. And they're just not even in the same world. The other thing that I don't love about this scale is I think it stacks the cards pretty heavily in favor of euthanasia, in the sense that natural death is never mentioned even as an option. And basically this is kind of a yes-no decision tree that either you do euthanasia now or you wait until your animal's score is lower and you do euthanasia then. So it's, the final thing that I don't love about this is there are certain processes that are a natural part of the dying process. For example, losing weight and not being as interested in food, that aren't necessarily indications that an animal is suffering, and can be part of the natural dying process. It's the same with human dying patients. You know, if a patient who is on their deathbed says, I really don't feel like eating, you don't force feed them or euthanize. You let them not eat. So the fact that weight loss and inappetence or not being hungry are counted as reasons to euthanize, I think isn't ideal. So 2 other examples of scales that I like better. And there's a resources toolkit that should be available. So you can find these if you're interested. You can also just Google quality of life assessment animals and you'll find lots of things. This one is Ohio State University. And as you can't see the details of it, but it's a lot more nuanced. There are a lot more items that it asks you to think about with your animal. And this one, which is developed by Lap of Love Veterinary Hospice, is also quite good. Again, it's more nuanced, it's more in-depth, and asks you to think a little bit more about what's happening with your animal. So neither of those, well, we've done 3. None of the 3 are quite right yet, because basically they're just, in my opinion, they're just step 1. They just ask you to assess the animal's current quality of life and kind of go from there. And this is where it's like a snapshot of a decision making. Ideally, you have a step 1 and also a step 2, is that you're tracking these things over time. One thing that we found with Odie is, on Monday, he might have felt awful, and you'd think, wow, we really need to call the euthanasia vet. On Tuesday, he may have really bounced back quite a bit. And you think to yourself, wow, that was crazy. I'm so glad we didn't call the euthanasia vet. And you can have these really variable patterns in how an animal is doing over time. So having a way to keep track and remember is really valuable. So keeping a journal, a daily journal or weekly, depending on what kind of illness trajectory you're looking at and how rapid an animal's decline is, kind of determines how often you need to maybe make notes in a journal. It could be several times a day. It could be once a month for a while, and then maybe once a week, and then maybe once a day. It doesn't have to be complex. You don't have to go through one of these entire quality of life assessment processes every single time you're trying to make notes in a journal. You might just put a smiley face. You might just have a little note, not himself, or wasn't very hungry, or extra hungry, or got more tired on the walk than usual. Seems needy, and any kind of information that you think you'd like to remember and is an indication of how your animal is doing and deviating from normal. You may not have noticed, because I breezed past the OSU, the Ohio State University scale, pretty quickly, but the title is, How Do I Know When It's Time? And the incompleted part of that sentence, time for what? And I think that what is meant there is time for euthanasia. And this tends to be the most common function of a quality of life assessment tool. You use it to decide whether it's time to euthanize. I think this is unfortunate, because quality of life tools can do so much more for us. In human medicine, the quality of life assessment is not used to determine whether somebody is ready to die. The purpose is to help understand what the patient values and to help caregivers create a plan of care that maximizes well-being or good quality of life for the patient while the patient is still living. I believe we could do animals a great service by understanding quality of life assessments as a guide for the living and not as a passport to the Rainbow Bridge. Done well, a quality of life assessment can help us understand what things are causing an animal distress or pain and what things are bringing pleasure and comfort, and they can help us shape creative treatment plans that maximize good while minimizing the bad. This is Odie eating. I call this Odie in hospice because at this point we had decided not to pursue any more aggressive veterinary treatments or care. A lot of pet owners with an ill or dying animals see their choices as pretty stark: suffering or euthanasia. And really, there's a whole world of opportunity in between those two. And that's where animal hospice and palliative care services come in. They can allow us to ease our animals more gently toward death and kind of fill in that space between suffering and death, whether it's death by euthanasia or natural death. And Odie is in hospice, but obviously here still enjoying one of his favorite foods, which is this kind of nasty canned dog stew. So like human hospice, animal hospice is not a place where you take your animal. It's a philosophy of care. And like human hospice, animal hospice focuses on care, not cure, and involves addressing the symptoms of disease. So addressing nausea or anorexia or constipation or fatigue or confusion, and of course, pain. Like human hospice, animal hospice really focuses care on the entire family, not just the patient, and addresses not just physical suffering, but emotional and social and even spiritual suffering as well. And like human hospice, animal hospice requires a lot of creative thinking about what the patient needs, what the family needs, and whether and how these needs can be met. Unlike human hospice, there's no 6-month mark for animals, and often the shift into hospice mode is quite gradual and subtle. So maybe you say no to further blood tests or to ultrasounds like we did with Odie. The vet suggested that we do back surgery to relieve his impingement because Odie was 14 years old, or the equivalent of about 90. We declined. You start to weigh the costs to your animal of continued treatment. So the stress of veterinary visits, the stress of being poked with needles or being prodded by strangers against the benefits. And you weigh your own caregiving resources against what your animal needs and against what your human family needs. And unless you have very deep pockets, you also weigh the financial costs of what's ahead of you. There are some symptoms, and I'm putting symptoms here in air quotes, that often trigger a decision to euthanize, but don't within a hospice mindset need to. And just 2 examples here are compromised mobility and incontinence, both of which we dealt with during Odie's final decline, and both of which admittedly are caregiving challenges, but and both of which can cause immense suffering to an animal and to the humans that surround that animal. Both of these appear on virtually every quality of life assessment tool, euthanasia decision-making list. And both can often be managed effectively without euthanasia, at least for a time. Still, in some situations, euthanasia may become the most compassionate course of action. And when we've exhausted all efforts to provide relief from pain, and what we have, to borrow a phrase from John Steinbeck, is just pain covered in skin. We're fortunate in the veterinary realm to have the option of hastening death. This is my dog Maya, who passed away 2 summers ago. One of the core commitments is that death is meaningful, both to the person who is dying and to their loved ones. Presumably, death has meaning to animals themselves. Every living being values his or her own life. We only get one life after all. And to each one of us, this life is infinitely precious. The death of an animal can also be profoundly meaningful to their human companions. An animal dying is an area of under-acknowledged suffering on the part of humans. So I'm going to talk just for a couple of minutes about human suffering. This is our cat, Thor. And this is my parents' dog, Murphy. So after I wrote The Last Walk, I was blown away by the number of emails I got from people who had lost an animal and who were profoundly suffering from the loss. And the depth of the loss just surprised me over and over in one sense. In the other sense, it didn't surprise me at all because I have been there myself. But if you're going through it, I think you can feel very alone, like nobody could possibly hurt as much as you are. People often tell me that the death of their companion animal was the most difficult loss they have ever experienced, more difficult than the loss of a parent or a spouse or a friend. One gentleman who was one of those that really sticks in my mind told me that he takes his dog Millie's ashes with him wherever he goes. And this is, I think, 20 years after her death. And she sleeps with him at night. Her ashes do. And you could say that's just pathological, but I don't read it that way. I find it really touching and just moving and sad. One thing that is uniquely hard about losing an animal in our society is that we may still experience what psychologists call disenfranchised grief. The sense that our grief can't really be expressed publicly because people will think we're weird, or that it's just a dog, get over it, that theme that is familiar to many people who have lost an animal. But for those of us for whom an animal is part of our family, the loss can be a really heavy blow. All right. I have a little bit on decisional regret, but I think I'm gonna move on to conclude, and we can talk about decisional regret if you're interested. This is, and this slide is also hard for me to look at. This is where we took the last walk with Odie, the last real walk. He was a dog who loved the wilderness, and hiking together was one of our great family pleasures. This is the place where we took him on his last walk. A couple months into his 14th year, about the time of this last walk, his body really started to fail him. He had withdrawn into himself. He refused to eat. He didn't even want to eat hot dogs and squeezed cheese, which for Odie was, like, you really knew something was wrong. He didn't want to participate at all in the life of the family. He just isolated himself and had this constant look of trouble about his face. And I would wake up in the middle of the night, and this happened every couple of weeks, to this weird scruffling sound. And I'd get up and search around the house, and usually by odor, I would find Odie in some really weird corner, like behind the leg of the piano or behind the treadmill. Clearly he was disoriented, and he would be covered with his own feces and struggling to get some purchase with his back legs, which really just didn't work anymore. And he'd flash the whites of his eyes at me. And after the fourth night like this, my husband said to me, we can't do this to Odie anymore. And that was the morning that I called the vet and said, we'd like you to come and euthanize Odie. And so absolutely the hardest phone call I've ever made in my life. And luckily I knew the vet because when I called her, and she knew what was going on, she had been following Odie's care with me. I couldn't speak, but she knew that it was me. So she compassionately gave me the minutes of time that I needed to actually get my voice and tell her what we wanted. I'll always wonder whether we did right by Odie in the end, whether he was really ready to die, whether maybe he longed to be released sooner than he was. And I'll always think that I could have done more for him during his last year. But I'm grateful that his actual death was peaceful and painless. He was asleep on his favorite couch. This is Odie before his death. He was asleep on his favorite couch when the vet arrived, and he didn't even wake up. She gave him a sedative and then the final injection. He was surrounded by his human family, and his canine companion, Maya, was on the couch next to him with her head rested on his back. And as Odie died, I was able to hold him and whisper in his ear everything that he meant to me. And I look forward to a time in the future when we can achieve for animals, as many animals as possible, a good death after a full and satisfying life. And when we can whisper into the ear of each and every animal dying in our care the words of Cicely Saunders, "You count because you are, and you will be of significance until the last moment of your life." And sorry, that was kind of a sad ending, but it's yeah, obviously I'm still not over Odie. I'll never be over Odie. But I have learned a great deal from his journey and my journey with him, and hope that I can pass on some of what I have learned through those experiences to other people who are going through that same painful process. So thank you all for listening to that. And I'm happy to take any questions or responses.
Jessica, thank you. That was great and a little emotional like we had planned. So I'm glad my tissues here. If you would like to go over a little bit of the decisional regret, if we have a minute, if you all would like to do that, that'd be great. And then we can hop into some questions as well. We have a little bit of time for that.
Okay, sure.
You can stop sharing your screen if you'd like us to look at you.
All right. Let me get my decisional regret notes.
Thank you.
Okay, stop share. So one of the universals, I think, of caring for a companion animal at the end of life is a feeling of regret. Maybe many feelings of regret during the process of companioning them, and also perhaps especially feelings of regret after all is said and done. Things that maybe you feel you could have done differently or should have done differently. I think it would be lovely if end-of-life decision-making was like a computer and you could just input this data and then it would churn around and make the noise that computers used to make when I was little. Not little, old, less old. And, it would spit out an answer for you. Here's what you need to do. And unfortunately, this kind of help is not available through technology. But I think working through an organized thought process, and thus the usefulness of quality of life assessment tools, can help us reduce the amount of regret we might feel. And one of the common sayings of veterinarians especially who work in hospice and end-of-life care, is what they seek to achieve is a path of least regrets. So it's not the path, it's a path, because there are a number of different paths that are good and that can be chosen. And it's not no regrets, it's least regrets, because there are always regrets. So decisional regret is something that's been pretty well studied in the human medical literature. And basically what it is that in any high stakes medical decision, whether it's a decision you're making for yourself about, should I have X surgery or Y surgery, or whether it's a decision you're making about somebody else, there is often a feeling of remorse or distress that patients and caregivers experience after making a decision. So it's a real risk. And end-of-life decisions for animals are they're high risk, because often you're making a decision about whether or not to kill your best friend. And a lot of caregivers or companions of animals report feelings of guilt. In fact, I almost never talk to somebody who doesn't have a sense of guilt or anguish over choices that they made for an ill or aged companion. Sometimes people feel like they were rushed into a decision by a veterinarian, for example, who's, you're at the veterinary office and you've been given some acute diagnosis, and veterinarians telling you, the kind thing to do is to euthanize right now, and sort of pushing people to make a decision that they're not ready to make. Often people feel like they drag their feet too much. They'll think, maybe they should have chosen euthanasia at a point much earlier than they did, because they were unwilling to part with their animal. And so there can be guilt for all sorts of different reasons. And I think it can plague people for many years and can cause immense suffering. There's a phenomenon in the psychology literature called responsibility grief. And I think that a lot of people who have made a decision to euthanize an animal feel that responsibility grief. Some even experience what Rachel McNair, another psychologist, calls perpetration-induced traumatic stress, by which she means actual PTSD symptoms that in response to having to make a euthanasia decision for an animal. So I think the goal in end-of-life care and end-of-life companioning is to create conditions for decision-making in which we minimize the risk of decisional regret. And one way to do that is to take the time you need. Research in human medicine suggests that when people feel that they have been rushed into or pushed into making a decision, they feel more regret. And, of course, there are situations where really a quick decision needs to be made, but oftentimes the urgency is less severe, and there is time to just step back and take the time that is needed to think through what's happening. Some people feel regret when they've made a decision based on incomplete or partial or even faulty information. You may say, well, if I had known X, Y, or Z, I wouldn't have made that decision. I would have made a different decision. And so arming yourself with as much information as you can about, for example, what a certain disease looks like in an animal if you've been given a diagnosis, what the trajectory of that disease looks like, what your options are for promoting good quality of life in the home, modifications to your homes, to the physical environment of your animal. And so I think there are a lot of ways we can kind of take control of the decision-making process in ways that reduce that risk of decisional regret. So.
Okay, well, we will call this the end of the workshop. Dr. Pierce, thank you so much for joining
You
us,
are
giving us
most welcome.
information. This has been
Yeah.
wonderful and a great resource for everyone that will watch this. And you also gave resources that we will include in a toolkit that you referenced. So people just have some information and things handy that they can kind of go through and not feel so scared or alone, but be
Yeah.
knowledgeable. And as you know, we like to have education before we need it. So
Yeah, exactly.
hopefully this will be
That's
helpful
the
with
best
that.
time.
I
So,
think so too. Well, thank you all for joining
yeah.
us today.
Thanks for coming, everybody.
Yes, thank you.
Take care.